Hello, this is Tony Heller from RealClimateScience.com, setting the record straight about science. President Trump is again bragging about his big testing. Cases are up because of big testing. Much of our country is doing very well. Open the schools. But unfortunately, he's missing the point and doesn't understand how he's been snookered by Dr. Fauci again. This article from the New York Times shows what's actually going on. One of the first school districts in the U.S. to reopen its doors during the pandemic did not even make it a day before a call came from the county health department. A student who had walked the halls and sat in various classrooms had tested positive. There's now such a huge stigma around this virus that even one child testing positive is enough to close the school down. Everyone's running around getting their kids tested, and the tests produce a lot of false positives. So Dr. Fauci has created a situation where it's impossible to open the schools. Now let's look and see if what Dr. Fauci is doing makes any sense. I captured this graph from the CDC website this morning. The red line shows the weekly count of deaths from all causes for people under 25 years old in the United States during 2020. The 5 gray lines are 2015, 2016, 2017, 2018, and 2019. As you can see, there's been fewer deaths for people under the age of 25 in the United States this year than there has been in the previous 5 years. It's pretty clear from this graph that COVID-19 is not causing a lot of deaths for people under the age of 25. In fact, the CDC says that the flu is 5 to 10 times deadlier than COVID-19 for children.
Districts will begin to wrestle with this. I think it is important to try to be factual as we go through this. When we look at right now the mortality of this particular COVID virus, in the first almost 218,000 people we looked at February to July, there was 52 individuals under the age of 18. And if I recollect, about 35 were actually school age. Some of them were younger than school age. We're looking critically at those individuals, and clearly there's an increase in comorbidities related to significant medical conditions that we've already assessed. But I think that's important, because what that means actually is the risk per 100,000 so far, into the outbreak, 6 months into it, is in fact that we're looking at about 0.1 per 100,000. So another way to say that, it's 1 in a million. Now, I'm not trying to belittle that. I'm just trying to make sure we look at it proportional, because if you do the same thing for influenza deaths for school-age children over the last 5 years, they're anywhere from 5 to 10 times greater. So I want people to understand the risk properly as they make that decision. And obviously, influenza, we also benefit from having therapy and a vaccine. So I don't want people to overestimate the risk of serious illness to individuals that are school age.
We don't shut down the schools for flu, which is 5 to 10 times deadlier for school-age children. So why are we doing it for COVID-19? The school which the New York Times is referring to is in Indiana. Let's look at their statistics now. Indiana has seen a large increase in the number of positive cases, but the death rate has been going down. What's happening in Indiana is they're testing a lot of young people who are not likely to die from the virus. Rather than relying on Dr. Fauci's theories, we should be looking at experimental evidence. We don't have to guess what will happen when schools open, because lots of schools are open already in other countries. Taiwan, Nicaragua, and Sweden never closed their schools. The experimental evidence shows very clearly that opening up schools is safe. Science magazine says that what Sweden did was a vast uncontrolled experiment, when reality is the exact opposite. Sweden simply did what the world's always done. It was the lockdowns which were the vast, uncontrolled, and disastrous experiment. 1,500 members of the United Kingdom's Royal College of Pediatrics and Child Health wrote a letter last month saying, "Continued closures risk scarring the life chances of a generation of young people." There's no scientific basis for keeping the schools closed, and it's doing a huge amount of damage to our children. So why has Dr. Fauci created this trap of big testing, which is driving Americans insane and forcing our schools to stay closed? During the 2009 H1N1 pandemic, which was much deadlier to younger people, CDC stopped testing. CDC stopped testing because they understood that doing too much testing was going to drive Americans nuts. So why is Dr. Fauci working so hard to drive Americans insane now? I'll be discussing that question in some more videos coming up this week. In the meantime, visit Toto on the web at realclimatescience.com. He's been pulling back the curtain on junk science and propaganda for a long time.